Hello, so today we're going to look at the Ottawa Knee Rules. These are a set of guidelines used by healthcare professionals to determine when a patient with an acute knee injury needs an X-ray to rule out a fracture. These rules help reduce the number of unnecessary X-rays, thereby saving time, reducing radiation exposure, and lowering healthcare costs. The Ottawa Knee Rules was designed in 1995 by Steele et al. As a diagnostic tool to divide cases of acute knee injuries into two groups, including cases who are likely to have an important bony injury and needs evaluation using X-rays, and cases who are not likely to have a significant fracture and do not require X-rays. So let's look at criteria for knee X-ray. So according to the Ottawa Knee Rules, an X-ray is required if any of the following criteria are met. So if the individual is age 55 or older, the likelihood of a fracture increases with age, making this an important criteria. Isolated tenderness of the patella. So tenderness directly over the patella without other bone tenderness may indicate a patellar fracture. Tenderness at the head of fibula. So if there is tenderness at the fibula head, this may also indicate that there could be a possible fracture. Now, the inability to flex the knee to 90 degrees. So if the patient cannot bend the knee to a right angle, it suggests a possible significant injury that may require an X-ray. The inability to bear weight, both immediately in the ER room or within a clinical setting for 4 steps, regardless of limping. So the patient cannot take 4 steps immediately after the injury and at the time of evaluation. So this inability indicates a possible fracture. So how good are the Ottawa Knee Rules? Are they sensitive? Can they tell that there's an actual injury? So from a paper that was published in 2023, this was a systematic review. So they looked at a range of papers and they said that the pooled sensitivity and specificity were 98% and 43% for the Ottawa Knee Rules. So these findings reveal that the sensitivity is high enough to be applied to rule out fractures in patients with knee trauma in emergency departments and has an adequate specificity. And this also matches up to other systematic reviews, meta-analysis, and other evidence-based research papers. So what are the benefits of the Ottawa Knee Rules? So it's efficient. It helps quickly identify patients who need an X-ray. It's cost effective. It reduces the number of unnecessary X-rays, saving healthcare resources. Patient safety, so it minimizes patients' exposure to radiation from unnecessary X-rays. And evidence-based. It's developed through research and validated in multiple studies. So what are the limitations of the Ottawa Knee Rules? So clinical judgment. The rules do not replace clinical judgment. Some cases may still warrant an X-ray based on the clinical assessment, even if criteria are not strictly met. Exclusions. So these rules are not applicable for patients with multiple injuries, altered mental status, or very young children. In summary, the Ottawa Knee Rules are a valuable tool in the assessment of knee injuries, helping clinicians decide when an X-ray is necessary to rule out fractures.